Good morning, everyone, and welcome to today's update on the Pfizer-BioNTech mRNA vaccine for children in New Brunswick. Bon matin tout le monde et bienvenue à cette mise à jour sur le vaccin Cominarty de Pfizer-BioNTech à l'attention des enfants. Speaking on behalf of the province today in the following order: the Honourable Dorothy Shephard, Minister of Health; Dr. Jennifer Russell, the province's Chief Medical Officer of Health; and Dr. Rachel Ouellette, General Consulting Paediatrician. Les porte-parole aujourd'hui dans l'ordre suivant sont la ministre de la Santé, Dorothy Shephard, la médecin hygiéniste en chef, le Dr. Jennifer Russell, et le Dr. Rachel Ouellette, pédiatre généraliste ici à Fredericton. Minister Shephard.
Thank you, Bruce. Merci, Bruce. Good morning. Bonjour. Last week, we learned that children aged 5 to 11 are now eligible to receive Pfizer-BioNTech Cominarty COVID-19 vaccine. The vaccine was carefully reviewed by Health Canada, and the National Advisory Committee on Immunization has recommended its use. Many New Brunswick parents and guardians have been waiting eagerly for the opportunity to have their children vaccinated against COVID-19. And I'm pleased to announce that as of Friday, they will have the opportunity to do so. Pediatric doses, which contain a smaller amount of the mRNA vaccine, have already started arriving in New Brunswick. À compter d'aujourd'hui, les parents pourront prendre rendez-vous pour leurs enfants dans une clinique organisée par une régie régionale de la santé en visitant le site gnb.ca/rendezvous-vaccine. Very soon, pediatric vaccines will also be available through participating pharmacies and potentially through some physicians. Nous voulons nous assurer que le plus grand nombre d'enfants possible pour se faire vacciner. D'autres cliniques auront lieu dans les semaines à venir. This has been a long time coming. Since the pandemic began nearly 2 years ago, I know that parents' greatest concern has been protecting their children from COVID-19. This is a positive announcement for most New Brunswick parents, but I also understand that some people are still unsure about vaccinating their children. Tout le monde veut prendre la meilleure décision possible pour son enfant. That is why I'm pleased to have both Dr. Jennifer Russell, Chief Medical Officer of Health, and Dr. Rachel Ouellette, a Fredericton-based pediatrician, joining me today. They will be available to provide more medical facts about the importance of vaccinating your children. And as a pediatrician, Dr. Ouellette will be able to provide us with helpful tips to help parents and children address any concerns they may have. I also encourage everyone to visit www.gnb.ca/coronavirus, where you will find a detailed FAQ about how the vaccine was developed, tested, and approved, the efficacy of the vaccine, side effects, and tips for helping your child get a needle if they are nervous. You can use this information to help make the right choice for your family. I can tell you that with the increase of variants of concern like the Delta variant, we have seen increased cases of COVID-19 in children in New Brunswick in recent months. Approximately 30% of cases reported since the beginning of September are among the youth under 20. By vaccinating as many people as possible, including children, we can significantly reduce the spread of community spread. We can also lower the likelihood that other variants of concern will change into more infectious strains. We can put ourselves on a path to moving forward through this fourth wave, beyond the pandemic, and back to a more normal life. We will all continue to have a role to play in eventually bringing the pandemic to an end. Now, parents have an additional tool available to them to help slow the spread of the virus and provide their children with an extra layer of protection. Thank you. Merci.
Good morning, everyone. Bonjour à toutes et à tous. Nous avons appris aujourd'hui que les parents et les tuteurs du Nouveau-Brunswick peuvent désormais prendre rendez-vous pour les enfants âgés de 5 à 11 ans pour qu'ils obtiennent la première dose du vaccin pédiatrique Cominarty de Pfizer-BioNTech contre la COVID-19. Il s'agit d'une excellente nouvelle car il faut vacciner le plus grand nombre de personnes possible pour ralentir la propagation du virus et réduire le nombre de cas actifs et d'hospitalisation. Today, we have learned that New Brunswick parents and guardians can book an appointment for children aged 5 to 11 to receive their first dose of the pediatric Pfizer-BioNTech Cominarty vaccine, COVID-19 vaccine. And somebody was asking me how to pronounce it the other day, and I actually looked it up, and it is pronounced Cominarty. And the name actually comes from several pieces of information, including the fact that it's a COVID-19 vaccine, it's to protect the community, it's to provide immunity, and it's an mRNA vaccine. So all of those things are combined in the name. So I just learned that. This is excellent news as we need as many people as possible to get vaccinated to slow the spread of the virus and help reduce our active number of cases and hospitalizations. Your child will need to have 2 doses of the vaccine for full protection, and we are following the recommendation from the National Advisory Committee on Immunization, which advises that children should get their 2 doses at least 8 weeks apart. So I know parents have many questions about vaccinating their children against COVID-19, and Dr. Willett is here today and myself to address some of those concerns. Le vaccin offert aux enfants est un vaccin à ARNM. Avant le début de la pandémie, peu de gens avaient déjà entendu parler du terme ARNM. Ainsi, je sais que certains ont des questions et des préoccupations au sujet de cette technologie et se demandent si elle est sécuritaire, surtout pour les enfants. The vaccine that is available for children is an mRNA vaccine. And before the pandemic began, many people had never heard of an mRNA vaccine. It was unfamiliar to people, and I know many people have questions and concerns about this technology and whether or not it is safe, particularly for children. So first, while it may sound unfamiliar, mRNA technology is not new. Researchers have been studying and working with mRNA vaccines for decades to explore treatments for everything from the flu to Zika virus to rabies. These vaccines have been used to trigger the immune system to target certain cancer cells in studies since 2011. And I do want to reassure parents that the development of these vaccines was not rushed. Because of the urgency of the pandemic, vaccine developers worked with scientists around the world to gather scientific data at the same time. And this unprecedented level of global cooperation allowed mRNA vaccines to complete all clinical trial stages. To explain how mRNA, or messenger ribonucleic acid vaccines, work in simple terms, they essentially teach your cells how to make a protein that will trigger an immune response. The mRNA molecule is like a recipe that tells the cells of your body how to make a spike protein to protect against COVID-19. Dr. Willett will talk more specifically about the pediatric vaccine, but I can assure parents that this vaccine has been tested thoroughly on children between the ages of 5 and 11 and has been found to be very safe and effective. While children are less likely to become severely ill from COVID-19, it can happen. They can also suffer from longer-term complications, and I do have colleagues and friends who were very much looking forward to this vaccine being available because they haven't really allowed their families to fully participate in simple things like even going to get groceries, et cetera, because they really did have concerns, and other family events, et cetera. So in terms of protecting your family and your community, from COVID-19, vaccinating your child does reduce the spread in the community for individuals that are at risk of experiencing severe illness, such as the elderly and immunocompromised individuals. We have seen our vaccination numbers continue to rise slowly over the last few months, and as of today, 87.5% of New Brunswickers 12 and older are fully vaccinated, and 93.4% have received their first dose. À compter de lundi, nous tiendrons compte des enfants de 5 à 11 ans dans nos statistiques sur la vaccination. Comme il s'agit d'un groupe d'environ 500 000 personnes, on peut s'attendre à ce que nos taux de vaccination diminuent légèrement au cours des prochaines semaines. Au fur et à mesure que les enfants de moins de 12 ans se font vacciner, nous réaliserons cependant des progrès en matière de vaccination et les taux recommenceront à augmenter. Beginning Monday, we will add children aged 5 to 11 to our vaccination statistics, which is a group of around 54,000 people. So you can expect to see those percentages take a small drop for a few weeks. But as more children under 12 get vaccinated, we will quickly see our vaccination progress improve, and those numbers will increase again. Throughout the pandemic, we have reminded New Brunswickers to take care of themselves and everyone around them by following public health guidance and getting vaccinated. With the approval of vaccines for 5 to 11-year-olds, we have the opportunity to go a step further. We can continue to take the best possible care of our young children by making sure they are vaccinated as well, and it's time that we can get kids back to being kids. Thank you. Merci.
Good morning, bonjour. My name is Dr. Rochelle Willette, and as Bruce mentioned, I am a general consulting pediatrician here in Fredericton, New Brunswick. For the past 20 months, we have all felt the impact of the COVID-19 pandemic. But as a pediatrician here in Fredericton, and as a parent myself, I know that this has been an especially difficult time for parents. Many parents have struggled with the adjustment of having our children learn from home for periods of time. We have also dealt with anxiety about our kids' safety when we do send them back to school. C'est pourquoi c'est une très bonne nouvelle que Santé Canada ait approuvé le vaccin à ARNM Cominarty de Pfizer-BioNTech pour les enfants âgés de 5 à 11 ans. Je sais que beaucoup d'informations circulent sur les vaccins contre le COVID-19. Il y en a de la bonne information, mais aussi de la mauvaise information. Il se peut que les personnes vaccinées hésitent à faire de même avec leurs propres enfants. I can tell you that, as a mother of young children myself, I am so eager to get them vaccinated as soon as I can. I want to assure all parents that the COVID-19 vaccine has been thoroughly tested and has been found to be safe for children. Health Canada is recognized internationally for its independent drug review process, and it bases its decision on scientific and medical evidence that shows the vaccine is safe and effective. Before it was even reviewed by Health Canada, the vaccine was tested through a series of clinical trials, and these studies determined that the vaccine is safe for our children. They also determined the most effective dosage for this age group, and this dose is a third of the dose given to people 12 and older. The clinical trials showed that the vaccine is just over 90% effective for children aged 5 to 11 after receiving both doses. Comme c'est le cas pour tous les autres vaccins, il est très fréquent d'observer des effets secondaires temporaires qui peuvent durer de quelques heures à quelques jours. Cette situation est tout à fait normale. Cela signifie que le corps de votre enfant réagit de façon naturelle et travaille fort pour bâtir une protection contre le virus. Il se peut que votre enfant ait mal au bras ou qu'une rougeur ou une enflure apparaisse au point d'injection du vaccin. Votre enfant pourrait aussi avoir des symptômes de la grippe, comme des frissons, la fatigue, des douleurs articulaires, des maux de tête, une fièvre légère ou des douleurs musculaires. Si ces symptômes se prolongent au-delà de 72 heures, parlez-en au fournisseur de soins de santé de votre enfant. The more serious symptoms are so extremely rare. While many parents have been eagerly waiting to have their children vaccinated, we all know it isn't always easy to convince the kids to get a needle. My kids call them pick-picks. In my practice, I often encounter children who are scared of needles, and I know how difficult it can be as a parent to see your child experiencing fear or distress. I recommend bringing your child's favorite toy to their appointment, or a distraction, like a phone or a book. It's okay to give them screen time for this scenario. You can also offer them some control by letting them choose which arm. I also know that some parents are more hesitant to have their child vaccinated. You may feel that your child is not at serious risk of contracting or becoming seriously ill from COVID-19. While some cases of COVID-19 in kids are mild and asymptomatic, it is also true that some kids have become very sick. They can end up hospitalized or even die. Long-term COVID-19 complications or symptoms like fatigue, shortness of breath, or difficulty concentrating can last for months after the infection. Le syndrome inflammatoire multisystémique chez l'enfant fait également partie des complications rares que peut entraîner la COVID-19. Ce syndrome peut causer une fièvre persistante et une inflammation extrême des organes et tissus, comme le cœur, les poumons, les vaisseaux sanguins, les reins, le système digestif, le cerveau, la peau ou les yeux. Beyond the risk of physical symptoms of COVID-19, we know that over the last 20 months, our kids have had to miss out on so much, yet they're so resilient. They've missed out from school, extracurricular activities, social events, and many are missing their grandparents or other family members outside of our region. This has caused increased stress on our children and has negatively impacted their mental health. By choosing to vaccinate your child, you can ensure they are able to continue with their daily routines and will not have to worry about missing out on important events and activities. Il se peut que vous ayez toujours des questions sur les vaccins contre la COVID-19. C'est tout à fait normal. J'encourage les parents et les tuteurs à bien se renseigner avant de prendre une décision sur la santé de leur enfant. Mais il est très important de faire auprès d'une source fiable. Et le site de GNB a beaucoup d'articles que vous pouvez trouver. Please talk to your pediatrician or your family doctor who can help point you in the right direction. We know that the vaccine is safe and effective in preventing major illness, hospitalizations, and death from COVID-19. En choisissant de faire vacciner toute votre famille, vous aidez grandement le Nouveau-Brunswick à traverser la 4e vague de la pandémie et à surmonter cette épreuve. Thank you. Merci.
Thank you, Minister Shephard. Drs. Russell Moulette. Merci beaucoup, Ministre Shephard et Dr. Russell et Dr. Moulette. Nous allons maintenant procéder aux questions des journalistes. Vous avez le droit de poser vos questions dans la langue officielle de votre choix. Chaque journaliste pourra poser une question et une question de suivi très, très rapide. S'il vous plaît, voulez-vous assurer de désactiver le son de vos micros. Ladies and gentlemen, we'll now proceed with questions from members of the media. Each reporter will have one question and a quick follow-up. You have the right to pose your question in the official language of your choice. Please ensure your microphones are placed on mute. Tim Roselle, Global TV.
Good morning. Thank you, Bruce. My question, I'm going to say, is for Dr. Russell, but either of the other two can jump in if they see fit. I'm just wondering from a distribution standpoint how the vaccine is going to be administered. Are you planning to target maybe areas that are experiencing high numbers of cases recently, like Zone 1 and other areas like that?
So Tim, thank you for that. It's my understanding we're going to be utilizing our locations that we have been using for vaccinations. This weekend, we'll be concentrating on RHA clinics first, and then pharmacies will be brought on board, and if we can utilize physician offices as well. But for this weekend starting, we're going to be utilizing our RHA clinics.
Roselle, do you have a follow-up?
Maybe a clarification and then a possible follow-up. Just to clarify, though, will it be strictly with the RHA clinics and no sort of special emphasis on those areas that are experiencing higher numbers right now?
No, this is the opportunity to book your vaccine will be opened up today, and so as those clinics book up, that's where those locations will be utilized first, and they are all over the province.
Okay, and then just as a quick follow-up for Minister Shephard, can you provide the latest numbers, Minister Shephard, on Horizon Health and Vitalite Network workers that are not vaccinated at this time?
I can, and I'm happy to. Out of 21,765 employees throughout the RHAs and EMA and B, a total of 320 are unvaccinated. I could probably give you a breakdown from a Friday figure I had. Vitalite was in around the 120, 125 mark. So the rest would pretty much belong to the Horizon. I think there was only single-digit numbers in EMA and B that would apply here. So we're grateful for everyone who stepped up to receive their vaccination. These numbers are dispersed throughout the province and manageable.
Thank you both. Vicky Hogarth, CHCO TV.
Thank you, Bruce. My question is for Dr. Russell and or Minister Shephard. Will you be recommending that vaccines for the 5 to 11-year-old age group be mandatory to play organized sports or go to restaurants? What's the future hold for that?
So I'll take that, Vicki. At this time, no. We really don't want parents under any more duress. We want them to be able to get their education into the vaccines as freely as they will. And we believe right now that as we've done with all of the other processes, we are opening it up and we'll see how it goes.
Ms. Hogarth, do you have a follow-up?
I do. Has there been a significant rise in student-to-student transmission, especially in the school setting in that 5 to 11-year-old age group this fall?
I'm not aware that there's been an increase in student-to-student transmission in that age group this fall. Most of the transmission that we're seeing is really in households, and that's true all over the province.
Thank you both. We're going to go to Laura Brown with CTV.
Hi there. I'm wondering if you're going to utilize schools or school clinics for the distribution of the vaccine.
Laura, not at this time. As you can imagine, understand the properties of the vaccine, the freezer temperatures that are necessary, and the preparation times. So at this time, we'll strictly be utilizing the RHA clinics, and then moving to pharmacies, and then hopefully in partnering with some physician offices as well.
Ms. Brown, do you have a follow-up?
Yes, wondering, you had mentioned, I think back in either September or October, that there'd be an education campaign somewhat for parents on the vaccine. Is that still happening? And at this point, are you aware of any kind of percentages or numbers or statistics on the hesitancy in the province?
I'll start, and if Minister Shephard wants to finish, my understanding is that there's education rollout materials at the federal level and the provincial level right now. And so if you go to our GNB website, you should find information there. And also we have a social media campaign happening. With respect to vaccine uptake that we're expecting, there have been federal surveys to look at that, and my understanding that at the federal level, the surveys showed that at least 50% of parents are planning to get their children vaccinated. I don't have numbers specifically here in the province, but if I do actually have them, then Bruce can get back to you.
Thank you. Jeanette Godin, Radio-Canada.
Annick n'est pas là en ce moment.
Bon. On va procéder avec M. Kevin Bissett.
Yes, good morning. Minister Shephard, you gave the statistics as far as the number of unvaccinated employees, but I'm wondering what kind of impact have you seen as a result of those, and any issues or things that had to be canceled?
To my knowledge, these numbers have been managed. They are dispersed all throughout the province in all different types of areas in the RHAs, from anything from maintenance to to healthcare professionals. So it's my understanding at this time that there haven't been impacts, that the RHAs have managed it.
Mr. Bissett, do you have a follow-up?
I do. Just a question for Dr. Russell. Wonder if she could give any kind of an update in regards to outbreaks at the Moncton Hospital and at Dorchester Penitentiary.
So my understanding is at the penitentiary, we probably will have additional cases today that we'll be announcing later, but we're ahead of the press release, so I can't give those numbers now. And with respect to outbreaks at the Moncton Hospital, we've got an ongoing investigation, and we'll have more news to follow.
Hidil Ibrahim, CBC.
Thank you. For Dr. Shephard or for Dr. Russell or Minister Shephard, can you explain a little bit about what impacts you think this rollout will have on general population spread and hospitalization numbers?
So the whole idea of vaccinating as many people in the highest percentage possible of our population is key to trying to keep numbers of cases down, which then translates into a lower number of hospitalizations. And so we would not expect to see a large number of children that would be requiring hospitalization, but we do know that, again, people of any age, whether they're vaccinated or not, can transmit, but it's much, much, much lower with 2 doses of the vaccine on board. So anything and everything that we can use with respect to trying to keep hospitalizations low, community cases low, that is the purpose of what's happening right now. And again, protecting children from the risks of hospitalization, but also from long-term effects of COVID.
And so protecting children would also then reduce the general population spread and hospitalization numbers, right?
Yeah, exactly. So people who are double vaccinated, it reduces your risk of actually getting COVID in the first place by about 25%. So your risk of contracting COVID in the first place, your risk of transmitting is lower. So, and again, with the Delta variant and other variants that may emerge, we do need to take advantage of all of those opportunities. No matter how small a fraction we're looking at, we do need to continue to try to look at those numbers and keep them as low as possible.
Ms. Ibrahim, do you have a quick follow-up?
Yes, very quick. Will there be a sensory-friendly location for kids to get their vaccine?
So throughout our vaccine rollout, there are adults and older children who have issues around whether it's privacy, confidentiality, or fear of needles and things like that. So within the RHA settings, and I assume within the pharmacy settings, they do actually have the ability to accommodate that need for a quiet area. Obviously, if there's a higher number of people requiring that, they would have to look at that. But my understanding is throughout the entire immunization rollout, they have been able to offer that.
Thank you.
Thank you.
Pascal Rochnog avec Radio-Canada, s'il vous plaît.
Oui, ma question est pour la ministre de la Santé. C'est par rapport à votre décision de ne pas distribuer le vaccin dans les écoles. J'aimerais comprendre quelle est votre logique. Parce qu'à l'île du Prince-Édouard et à Terre-Neuve, les gouvernements ont l'intention d'inclure les écoles dans la distribution. Donc, j'aimerais savoir c'est quoi votre explication. Pourquoi est-ce que ce n'est pas dans les plans au Nouveau-Brunswick?
So we have worked with our RHA partners in this, and at this time, we we need to see how the vaccinations go. We believe that the RHA clinics around the province, there are an extensive number of them throughout the entire province, rural and urban, and the vaccination will start this weekend. So as we see, how this rolls out and how things go, there may be pivots that we do, but right now, our goal is to get these in the arms of children in this weekend, and it makes sense to use the locations that we have for expediency.
Monsieur,
Merci. Ma question.
as-tu un suivi?
Oui, rapidement, la ministre de la Santé. J'aimerais savoir, est-ce que vous avez l'intention de demander la vaccination pour les enfants qui vont à l'école? On sait que le ministre Dominique Cardy s'est déjà prononcé en faveur de la vaccination obligatoire lorsque le vaccin sera disponible. Donc, est-ce que vous allez rendre le vaccin obligatoire pour l'apprentissage en personne à l'école?
It's premature to go there. We're not there yet. I believe we need to, just as we did with the vaccine rollout for adults and 12 and over, we need to see how this goes and discuss our options at a later date. But right now, we just need to make this available and see how the uptake goes.
Merci. Thank you both. Justin Dupuis avec l'Acadie Nouvelle.
Oui, question pour Mme Shephard. Encore un mot sur la vaccination obligatoire. Vous avez dit que c'était encore trop tôt pour voir si vous comptiez rendre la vaccination obligatoire dans les écoles, mais je me demandais si vous avez une idée d'un seuil en dessous duquel que vous pensez que ça deviendrait nécessaire. Est-ce qu'il y a une cible, en d'autres mots?
We will be beginning clinics this weekend. It's our very first clinics open to children ages 5 to 11. We really need to see and let this unfold. No, I don't have any conversations about thresholds yet.
Monsieur Dupuis, as-tu une deuxième question?
Oui, pour Mme Russell ou Dr. Wallet, je me demandais si vous pouviez expliquer un peu comment le vaccin pour les enfants diffère de celui qui a été administré aux adultes. Je sais que tout à l'heure, vous avez mentionné que c'était un tiers de la dose, si je me souviens bien, mais pouvez-vous juste donner un peu plus de détails là-dessus?
Pour clarifier la question, c'est quoi la différence avec la dose pour les 5 à 11 comparée aux 12 et plus, c'est ça?
Oui, de quelle manière le vaccin Pfizer-BioNTech qu'on a donné aux adultes est différent que celui que l'on va donner aux enfants?
La grosse différence, c'est que c'est seulement 0,1 microgramme comparé à 0,3 microgrammes pour les plus vieux. Tu vas voir les petits détails à propos des ingrédients à l'intérieur pour que la petite dose peut être contenue pour plus longtemps. Mais c'est vraiment la seule différence. C'est la même technologie, la même science. C'est juste la dose puis les ingrédients qui vont contenir le vaccin.
Merci.
Je vais juste ajouter qu'il y a aussi une différence entre le nombre de semaines entre les deux doses. Alors, pour la dose pédiatrique, c'est 8 semaines entre les deux doses.
Taylor Sponang, CTV.
Thanks, Bruce. Dr. Russell, I know you mentioned that you don't have a lot of information in regards to the current outbreak at the Dorchester Penitentiary, but are you able to tell me if there is anything being done by the province to assist with the current situation?
Well, with all outbreaks in vulnerable populations and settings, we do have our prompt teams that are able to do screening and rapid testing throughout an institution like that. So my understanding is there is mass testing happening in that institution.
Ms. Bonang, do you have a follow-up today?
Thank you. Yes, I do. I'm wondering if you're able to, if anybody on the panel today is able to provide an update on the outbreaks within the multiple First Nations communities across the province, how things are going there, case counts, that sort of thing.
Well, we've actually had some discussions which we've shared with you previously around the sensitivities and confidentiality around case reporting. So the commitment we've made to First Nations communities is that we will report at the zone level as opposed to First Nations community level, and we are still waiting for some feedback from other First Nations communities. But that was our commitment, and we're going to stick with that commitment. And so all I can say is that our usual approaches with respect to First Nations communities in those settings, in whatever outbreaks or case counts are happening, we do have relationships at the community level with our medical officers and our regional teams, and they're working on all the different situations that are happening at the same time.
Thank you. Savannah Odd, Telegraph Journal. Savannah? We'll cycle back in a minute. We're going to go now with Erica Butler, CHMA.
Hi there, thanks. Question
Hello?
for, I guess, hi, can you hear me?
Yes.
Okay. There are fewer pharmacies participating in this pediatric round of vaccinations. I'm just wondering if I guess either Dr. Russell or Minister Shephard has
I'm hoping you can hear me because I cannot hear you.
Hang on, Savannah.
So, Dr. Russell, you've said throughout the pandemic, cases in children are usually mild. So I guess from a communications perspective, how are you going to convince, oh, I'm so sorry.
Okay.
So
We're going to deal with Erica Butler first.
okay.
About Erica, can you please continue your question about the pharmacies?
Sure. So there are fewer pharmacies participating in this pediatric round, and I'm wondering if you have any idea why and maybe what the numbers are, and if there are concerns about that, about the rollout being slower.
Yeah, I think we need to see how today goes. We need to see how many people are signing up. We have, it's Tuesday. We're going to start the clinics, I think, on Friday, Saturday, Sunday for the weekend. And so the scheduler is open now. And I suspect that we're going to have a lot of people trying to get on that. So I think we really need to see what resources we're going to need. We're looking at about 54,000 children. And so it's much less than the actual population. And so we're going to be able to, it's too early to tell with regards to what resources we're going to need. But we know we have them, right? Pharmacy has participated in this all along. And so we know we have them as a partner.
Ms. Butler, do you have a follow-up?
Yes, please. I'm wondering, can we expect clinics this weekend in more rural areas? Will the rollout this weekend be widespread right away, or will it be concentrated in the cities?
So we know we have some rural, Charlotte County, for instance, but the schedule is up now. And I think what we need to see is the bookings that are happening and then where we might have gaps. But again, we're talking about 54,000 compared to the hundreds of thousands that we've already done. So I think that as always, we start early with our rollout and we pivot when we need to and either enhance with more services and bring our pharmacies online. We know we're bringing pharmacists online. So I expect that we'll be able to fill gaps that way.
Thank you. Savannah Odd. Bobby Jean McKinnon.
Yes, hello, can you hear me?
Yes, loud and clear.
Thank you. Dr. Willett, what are the main concerns you're hearing from parents about the vaccine?
A little louder, please.
I'm sorry, Dr. Willett, what are the main concerns you're hearing from parents about the vaccine?
So the question was, you would like to know what parents are concerned about with this vaccine, correct?
What you're hearing from parents, yes.
What I am hearing from parents. I think it's just the unknown, right? We all want the best for our children. The studies have been done. I have reviewed them with a critical eye and feel they're safe. And parents are trying to access that information as well. And so I think it's just the unknown. But I can tell you that with the information that we have now, we know that it is safe and that it is effective.
Thank you. Ms. McKinnon, do you have a follow-up today?
Yes, I do. Thank you. Dr. Russell or Minister Shephard, how long do you anticipate to get the first doses administered?
A little closer to your microphone, please, Ms. McKinnon.
Sorry, Dr. Russell or Minister Shephard, how long do you anticipate it'll take to get the first doses administered?
As always, Bobby Jean, with rollouts, we have to see what the uptake is. And I'll be anxious to see during this day what the status will be and how many children are booked for their vaccines throughout the province. But I think it's too early to know exactly how long it's going to take. We always know that we usually start strong and we win and wang and we'll see how those numbers come on a daily basis. I think it's too early to decide how long this is going to take.
Thank you. Savannah Odd, Telegraph-Journal.
Hi, can you hear me?
Yes.
Okay, great. So Dr. Russell, you've said for over a year now, I guess, that cases in children tend to be mild, asymptomatic. So I guess moving forward, how do you plan to convince parents that this is necessary? If we're talking mild infections, why bother? How will you kind of address and get ahead of those questions?
That is a very common question. And I think when you're talking about children, we want to protect every single one of them. So even if the number of kids who would get sick is very small, that is not an insignificant amount when it comes to children. So that's first and foremost. Parents want to protect their children not only from severe outcomes with respect to hospitalization and death, but they also want to protect them from long COVID and the long-term effects of COVID. So we know there's those issues that parents are concerned about for their children, and we are as well. And we also know, again, that the benefit for the community is also there with respect to lowering transmission, lowering the number of people who will get infected, and thereby lowering the number of people in total who would need hospitalization in order to protect our healthcare system.
Ms. Odd, do you have a follow-up today?
I do. Thank you, Bruce. Also, probably for Dr. Russell, earlier this year, the CDC had been studying some stats around heart problems in young boys after getting the vaccine. I guess for those who sort of saw some of those statistics that might have been concerning, do you know if there's any available numbers or sort of statistics around the negative outcomes for youth who get COVID, whether that's hospitalizations, whether that's long-term effects? Is there anything that can maybe help people see that picture a little clearer?
It could be in the materials that we have at the federal level or the print level. I'm going to review them again to find out. But certainly with respects to the vaccine itself, in terms of the side effects and reactions that we've seen with the 5 to 11-year-olds, the studies that I've looked at haven't really had any adverse reactions other than the local reaction of redness and soreness in the arm, which, again, in terms of reassurance and confidence in the vaccine, I think, again, that low dose for that age group does provide a great amount of immunity without the same systemic reaction that you can see with other, with the higher doses in older kids.
Thank you. Thank you, Dr. Russell. Thank you, Dr. Ouellette. Thank you, Minister Shephard. Merci beaucoup à vous trois. That concludes today's update. Thank you very much. Voilà la fin de notre mise à jour. Merci beaucoup, tout le monde.